Hey everybody, Martin here with Tree of Light Health. I just thought I'd share with you a really awesome call that we had with Mr. Tapley Holland, the owner and founder of TruDose PRP technology. What I would like to do is just maybe give you just a few minutes of a primer on that talk so that you can refer to it after these few slides. Tapley has been an amazing voice in the regenerative technology field with almost over 20 years experience in PRP and stem cell technologies. What we're seeing with this technology is quite amazing. We're seeing a 20 to 40% improvement in multisystem chronic issues, which is utterly profound. Tapley talks about how it helps with brain, heart, and lung function, brain function especially by boosting BDNF or brain-derived neurotrophic factor. And we're also seeing an improvement or a faster resolution of chronic inflammation. Unfortunately, many of you are dealing with SIRS and you're trapped in a situation where there's a cell danger response or hibernation, and it's very hard to pull out of that. But anyhow, we believe that this is going to accelerate that process, which is really exciting. At around actually minute 59, there's a great explanation by Tapley on the emotional reset that this technology can provide. And we're of course very excited about that, as many of you unfortunately are dealing with PTSD trauma. And then there's really a profound case of healing from a 30-year chronic Lyme case, and that's at about minute 42. So anyhow, we are using as well, as you may know, very advanced biofeedback technology here called autonomic response technique. And the point of that is to really identify what's going on with you in terms of toxins and infections. And we do that on the very first visit. And this can really save a lot of time and money. In other words, if you're guessing whether or not you have Lyme or mold or Epstein-Barr or parasites, we can quickly identify that without spending all the money that's traditionally seen in functional medicine. Not to say that those things aren't valuable, but we can certainly determine that and then determine why your terrain or your biology is hosting those things, and then figure out how to detox them. We're able to optimize the autonomic nervous system using that technique and to try to assist the body to pull out of fight or flight to help modulate the immune system. We do that with a system called Reprogram, which is a little bit too advanced for this brief talk, but as you may know, we use magnets, lasers, signal enhancers, pole filters, scalar energy technologies, and many other things to accelerate the healing process. And then we assist you to detox your body and rejuvenate the body using peptides and hormones and things like that. And we're seeing quite a bit of improvement with many of our patients. And then, of course, once we get to the emotional layer, which is the unresolved psycho-emotional traumas that many of you unfortunately have, we're really able to see breakthroughs, and that's quite exciting. But the problem has become over the years is with COVID, especially post-COVID, leading to chronic inflammatory states, the never-ending SIRS and biotoxin threats such as mold hits. And in fact, if we can get you somewhat regulated and improved, and if you walk into a moldy building or get a re-exposure, then we have to start back to square one, and that's really difficult, and the body stays inflamed. PTSD, as I mentioned, that is the very difficult layer, despite some of the best things that we're doing. And that remains a challenge. The ever-increasing toxicity. Some of you, unfortunately, are dealing with immunodeficiencies, and that's very, very challenging because if there's no immune system, then how can the body heal? So we're looking for solutions for that. EMF and 5G are a constant threat, as you may know, leading to systemic-wide inflammation and from one degree or another, from small aches and pains to sleep difficulties, anxiety, et cetera, et cetera. And then there's quite a few that are dealing with multiple sensitivities, everything from foods to supplements to some of you, even homeopathics, cannot even take even the smallest amount of homeopathic. And of course, all of this generates quite a bit of fear and trepidation, chronic fight or flight, and the body just can't heal when it's like that. So some of our most difficult cases, this is sort of the constellation of things that we're dealing with. I forgot to mention concussion stress, which is also previous physical traumas to the brain. In any regard, unfortunately, all of this has led to a chronic state of inflammation and, almost like a cell danger response, like I mentioned earlier. That's Dr. Rabia Robert Navio's work, where we're almost stuck in a super hibernated state. Tapley talks a little bit about that in his presentation to follow, so check that out. Anyway, we now have a really wonderful way to accelerate this healing process by using this regenerative technology called TruDose PRP. However, there's still an art to it because even within the software itself, there's multiple programs. Like, for example, there's one for Lyme, there's one for mold, there's one for general wellness, there's one for chronic fatigue, Epstein-Barr. And we're able to probably, we are able to use our techniques to accelerate which program, the choice of which programs we use, and then combine that with the things that we're already doing to help the body really improve its ability to heal. And when we combine that with the advanced detox things that we're already doing, such as C60, such as Brown's gas therapies, all of this is we can teach you to do at home. The anti-inflammatory supports, the mitochondrial supports, the bioidentical hormones and peptides, and we'll combine that with regenerative technologies like TruDose. We really can see quicker improvements in terms of symptoms and quality of life. We're super excited about that. In any regard, that's it for my little intro here to Tapley's talk. So please check it out. If you guys are interested in this therapy, please do reach out to us, and we'd be happy to get you on the schedule for a consultation, or you can simply email us at martin@treeoflighthealth.com or info@treeoflighthealth.com. And we'll be presenting more and more about some of the findings we're seeing with some of the initial treatments that we're doing. And so stay tuned.
Okay, if I get going?
Yeah, man, go ahead, go for it.
So I guess thank you, Martin, for scheduling this and having me on, and thank you for everyone who joined. I'm sorry if there's background noise. I'm in a hotel, can't get into my hotel room, so this is the best I could do. But everybody's on here hopefully because of the TruDose therapy, and the purpose of this presentation is to let everybody know what exactly is the TruDose therapy, what is it, how is it created, and I'm going to show everybody a presentation that I just gave last week at the Autism Health Summit, which was a conference down in San Antonio. It was in front of parents and doctors. It was pretty well received, but I'm going to go over it very quickly and and it's meant for more of the patient consumption, because in response to doing a lot of these Zoom calls, patients want to know, can I have more understanding of the science? Which is a lot different from when we first started about 4 years ago, which is actually 6 years ago, which is, help me believe that this therapy will help me. Now it's kind of transitioned to patients want to know more of the science, but I'm not going to get lost in the weeds with everyone. So I'm going to go over it really quickly, and if anybody is not on mute, put it on mute. And if you have questions, put them in the side of the chat. And at the end, we will get to everybody. So let me share my screen. Martin, do me a favor, shake your head if you can see this. Okay. And you can hear me okay?
Oh, yeah.
So the title of this presentation is Reversing Systemic Inflammation with the TruDose Therapy. Those are my disclosures. Here's all the references to the talk in case anybody wanted to check my work. But this is what we're going to talk about. And this happens to be, I changed this for the autistic brain, but really this relates to anybody with systemic inflammation. And I'm just happen to show you something that I sent last week. So how does the body heal? Well, with any of the conditions that you may have, that we're going to be talking about tonight, that you're going to have questions about, this is the one fundamental thing you have to understand, is that the body repairs itself in an orderly repair of events. It's a machine. And at each step, like right here, step 1 to step 2 to step 3, at each step, the body ensures that certain things are satisfied before it will let it progress on to the next step. And so the immune system works the same way. Now, the first 2 steps are really, there is an injury, and I want to, trigger some inflammation. And these are more slides to show that when we get injured, our cells start to lose communication. They start to conserve oxygen, and they release energy into the bloodstream. And they release energy in the bloodstream because they're in this state of fight or flight. And so if the damage is too sustained, if the damage is too severe, then the cells will essentially go into a hypersleep. But at any rate, our cells release these status reports into the bloodstream to let something know in the bloodstream what has happened to it, how bad it's been injured, and what is needed for it to be fixed. And these things right here that I'm referencing are examples of just that. Again, I'm going to try to blow through this quickly. Now, the third stage of healing is the body has to make sure that there's adequate blood flow. If you don't have blood flow, you can't have oxygen, you can't have nutrient transport. And the last stage is what's called biomass replacement. This is where stem cells are called in to fix the final remodeling. And so I'm gonna really skip over these slides because it's really, kind of nitty gritty. But again, I'm just going back to that. When we heal ourselves from anything and everything, it's a system of orderly events. And when we complete that set of events, whether it's the immune system or the repair system, when we complete that particular event, we enter into the sleep cycle. So what that means is that if you're not experiencing any deep sleep right now, that somewhere along the way that there's a certain repair event, whether it was from when you're in your childhood, whether it was emotional trauma, whether it was a virus, there's something that has yet to be cleared out and has not completed that cycle. So that's what leads us to inflammation, is because if we're going through this orderly set of repair of events and we get stopped at a particular event in the cycle, then our body will not let it progress forward to the next step. In this case, it stopped at step 2. And so what happens is your body will perpetually stay stuck in this feedback loop of inflammation, meaning I'm not going to let you progress forward until I have what I need. And the same thing happens for the immune system, whether it's a virus, a bacteria, a fungus, or whatever. So really inflammation, it can just be seen as a singular unresolved repair event. Again, it could be emotional, it could be a virus, it could be a broken bone you had when you were 9 years old. But so what is systemic inflammation? Well, if you start stacking these, I'm going to skip through this part of it. If you start stacking these unresolved repairs on top of one another, what happens is one unresolved repair event leads to another, which leads to another, which leads to another. So they progress from these simple inflammatory type conditions to the more advanced peripheral related. So that's how we have Raynaud's, sexual dysfunction, macular degeneration. Cancer is in this category too right here. If it keeps progressing, then it will eventually progress towards chronic, neurological, fine motor loss, cognitive dysfunction. You can see a lot of mental disorders are in here. So mental illness is something that's acquired. It's not pre-genetically disposed. We literally can acquire these things over a lifetime, or in what I was talking about last weekend, where we can have a singular event, which really happened to my 5th child, which threw him into basically systemic inflammation. And as from an emotional standpoint, how our autonomic nervous system overlaps this disease progression looks like this. You have the parasympathetic over here on the left, you have the sympathetic on the right. And when we're in these category 1 diseases, we can still feel grounded, we can still feel love, we can still feel empathy. But as we progress towards the stage 2, that's when anger starts to set in, worry, and you get over here to these category 3 conditions, chronic Lyme, mold, chronic fatigue syndrome, etc. And this is where emotionally we feel basically depressed, hopeless, we feel unconnected. That's why autistic kids lack a capacity to connect. It's not because they can't, it's because their body is in this mode of fight or flight. Your body will not let you feel love. It's a survival mechanism. So systemic inflammation is really many unresolved issues stacked on top of one another. plus sympathetic emotional distress. And I can tell you, I don't know if this is part of the talk or not, that you have to remove the emotional. Otherwise, the physical is there, but you have to remove the emotional. Otherwise, you cannot heal the physical. I'm going to skip over this because this happens to relate to the autistic brain. But so, and whether this is, and so I'll skip right into this. And the part of the talk I was giving is this: there's all types of treatments that we can do. They all have their benefit. But if you are in an inflammatory state, which you probably are, that the cells are not communicating with one another, that there's a lot of things out there in the bloodstream that are saying, this is what I need. This is what I need to fix myself. This is how I get myself out of this feedback loop. No, undoubtedly, there's pathogens and parasites and toxins that are overloaded in the bloodstream. If you're there, then there's a lack of blood flow and nerve growth related to really any one of those conditions. If you're over in that category 3, you have sympathetically shifted to where you're disconnected from the world, you're depressed, and your body is hypoxic. So at this particular talk, I was saying, does it make sense that I should give myself stem cells into an environment that has all of this stuff going on? And the intuitive answer is hopefully no, but I said, this is what we can give, is your body's platelets. And here's why. It's because your platelets, if you were to Google, what do they do? You can do this right now. You would find that our platelets within our bloodstream are mainly there just for clotting. And I can tell you right now, I'm going to skip over, well, I'll go ahead and show you this. I can show you this right now that I gave this presentation to a number of doctors at a Freedom Conference a few months ago. And I threw this quote out there and I said, can anybody guess when this study was published? Right? And basically saying the platelet forming organs, depending on something's ability to act on the body, will influence the platelet counts increase or to decrease. And I said, can anybody guess when that was published? And there were a number of answers in the audience, but nobody guessed this. And I said, what I'm trying to illustrate to you is that there's something more important to the platelet than just making sure we don't bleed out, and to make sure that we just are they're just a clotting. So they obviously knew something back then a long time ago, that the importance of the platelet. And I'm just going to go through this again just to give you guys a high level and appreciation. But we make our platelets from our bone marrow at about a rate of about 70 million per minute. And our platelets are derived from these hematopoietic stem cells, which are transferred to our lungs. Now, our lungs takes those, and it takes some of those stem cells to the side, and it takes some of those and turns those cells into big platelets and small platelets. Why? It's because our larger platelets are carrying more weapons and more repair. Now, the platelets are then released down into the spleen, where 33% of our larger platelets are kept in a reservoir over in our spleen. And this population, if you're healthy, is turned over about every 8 to 10 days. So really, our platelets are being manufactured by the body and being strategically placed in different organs in response to inflammatory things, pathogens, stressors, virtually anything that can happen to us at any given moment, and is happening to you right now. And depending on what is happening to us, will alter the platelet size, what it's carrying, what weapons it's going to carry on itself, what repair, what needs that our body needs, and the rate at which our body will produce this. So we could really think of platelets as a very determining marker of real-time disease state. Okay. Now I can tell you from the data we've collected, I can look at somebody's platelet count and almost within reason determine what's wrong with you. So why platelets? Because when it comes to the repair system and the immune system, our platelet is actually responsible for overseeing and starting both of these two activities. So the platelet encounters a problem and it starts the repair system. The platelet encounters a virus, it starts the immune system. And in some cases, it actually actively becomes a participant at certain steps. So again, I'm gonna skip over this. I might highlight a few things just because of what Martin was saying he wanted me to go over. But I showed this particular study at the conference and said, listen, our body is in an inflammatory state. Well, guess what? Platelets can release anti-inflammatory things. Platelets have, they do clot, but when they don't need the clot, they won't clot. So platelets have these paradoxical properties, and there's a lot of them. Depending on what the body needs, it'll do this. Depending on what the body needs, it'll do the opposite of that. When cell communication is shut down between the cells in our body communicating, guess who's the one thing that communicates all activity between the cells? It's your platelets. So your platelets can be really seen as like the Facebook Messenger capturing all of this data from all of our hurt cells. And it's saying, well, I'm constantly surveilling the bloodstream. And this is one of my favorite papers, making an analogy, which as platelets are like drones circulating the bloodstream, looking for really two things: repair needs and immune threats. And again, I'm going to blow through a lot of this, but when our cells are not communicating with one another, these are basically the nerdy kind of science stuff to say platelets have all of these receptors and all of these communication devices that our cells and our body, when they're hurt, they're constantly picking up this traffic of information, and they're taking it, and the platelets are doing something with it. For example, when our cells get hurt, these are a small list of anything that can happen to our cell, and our cells throw these status reports out in the bloodstream. And then the cells close down their cell walls because they don't want to talk to anybody anymore. Well, guess who's the one thing that has receptors for all of these different injuries that could happen to our cells? It's the platelet. So the platelet has receptors for pretty much anything that can happen to the cell. I'm going to skip over this one. Well, you know what? No, I won't. If the damage is so severe and you are basically at a chronic neurological dysfunction, there's many cells in your body that are gone into hypersleep. I'm just going to call it that. And this hypersleep is the hallmark of age-related diseases. It's called cell senescence. But platelets and concentrations, which is what we're going to talk about, have the ability to bring these cells out of hypersleep and basically back into the game. So what about pathogens, parasites, and toxins? Well, that goes into tracking and weapons. Your platelets have every type of pathogen recognition receptor so in other words, what is a virus? What is a bacteria? What is a fungus? What is a mold? That is pathogen recognition. Our platelets have those homing devices on their surface. What is pattern recognition? Pattern would be, are you the flu virus? Or are you the herpes virus? Are you the strain from last year, or are you a new strain? Because viruses will do the same thing to our body pretty much because that's all they know how to do. But they'll change the way they do it and attack our body. But they'll always do the same type of pattern of attack. Well, our platelets can recognize not only that you're this virus strain versus that virus strain, but, oh, I can see what you're trying to do to me and let me go on the defense or the offense. And to illustrate that point, many of you have Epstein-Barr or maybe herpes or a number of viruses. I show this slide because I can make an argument right here that this God-given intelligence that we were given was built into us from the beginning, and this is all we need to protect ourselves from anything and everything we can come in contact with. And if we do the TruDose therapy and take this out of our body and put it back in and reset a lot of this communication right here, I can make an argument that this would be the best vaccine schedule you can get. So I'm going to skip over this next part and get right into the therapy itself. You know what? Before I do that, I'm going to highlight this. just to show you something. So platelets at step 3 are actually carrying the one growth factor that's responsible for blood vessel formation. So there's nothing in the body that creates blood vessels other than your platelets. So in other words, they start this process and chain of events, but at step 3, they actually actively engage and start releasing this growth factor to create new blood vessels. And you need that. Otherwise, there's no oxygen that can get there. There's no nutrients that can get there. There's no supplements you can take that can get there. What about this one? If you have a neurological condition, just insert the blank, you're going to need this growth factor. And guess who's the one thing that carries around 99% of it? Your platelets. What about if you can't detox correctly? You need the hormone serotonin, because that's how we regenerate our livers. Guess what's the one thing that carries around 95% of your body's serotonin? Now, the platelet doesn't manufacture serotonin, but I'm simply pointing this out to say God was pretty cool when he says, I'm going to give the platelet the one, all these different things to hand it out when needed, when our organs and our cells need it. And there's a whole list of other things the platelet carry because, again, based on demand and what our body needs, our bone marrow will respond, and produce these platelets carrying what we need. So this leads me into the TruDose treatment, which is why we're on this call. Well, the TruDose treatment, at the heart of it, is platelet-rich plasma, which many of you have probably had, which is a treatment that's derived from your blood. It's a regenerative treatment. And the historical definition of PRP is saying, I'm going to take blood, I'm going to concentrate it in a centrifuge to create a high concentration of platelets over the baseline count of platelets in your blood. And so how do we create PRP? Well, you take a volume of blood from your arm, okay, like a blood draw. You put it in a centrifuge to separate the components based on their weight. And so the red blood cells are the heaviest, and everything else is lighter than the red blood cells. You take the everything else and you put it into another canister, and you centrifuge it again to separate out based on its weight again. And what falls to the bottom are your platelets. And what's left at the top is basically the water content of your blood. So PRP has 30 years of data on safety and efficacy of its use, mostly in the sports, dental, and hair field. But no one's ever really said, well, what dose of platelets will heal what condition? Or what, and that's the problem, is that we've never really understood the dose response relationship to any of these therapies. So that's why, and so if I don't know the dose response relationship, what happens is, that's why many of these therapies have a 50-50 response rate, depending on if it's platelets from your blood, if it's stem cells from your umbilical cord, if it's stem cells from your bone marrow, it doesn't matter. If we don't know what dose will heal what, that's why you hear reports that it worked for my friend, but it didn't work for me. So, and to illustrate that, let's just pretend that everybody on this call has a knee problem. And you go to Martin's office and he says, I'm going to give you a PRP injection. Historically, this is how everybody would get a PRP treatment. They would take a 10 mil blood draw, or maybe it's 30 mil blood draw from each one of you on this Zoom call. So 10 mils from the guy in the left corner, 10 mils from the lady right here in the middle, and 10 mils all around. And we would take that 10 mil blood draw, we would put it in a centrifuge, process it just like I just showed you, and then have this concentration of stuff that we're going to inject back into our knees. So the question is, if we take biologically different people, we do the same blood draw to everybody, should we all have the same therapeutic results? And hopefully the answer is no, but that's the problem that's existed with all of these therapies, and more specifically, platelet-rich plasma. So that's why in 2018, I created the TruDose technology, which solved that fundamental problem of dosing within the field of regenerative medicine. And this is how it's done in the office setting. You would walk into the office. They would take a finger stick and take a few drops of your blood. It would be measured over here in this analyzer. That measurement would go into the software which I created, which would use all of these analytics and metrics of all the factors that really impact healing and non-healing, which is way beyond the scope of this call, to determine one thing: how much blood do I need to draw from you for this specific condition to create a specific dose of platelets to make sure that something therapeutically happens. So, and the software is about 95% accurate to help you produce that therapeutic dose, whether it's Lyme disease, my knee hurts, make my hair grow, autism, thyroid condition, Epstein-Barr virus, it doesn't matter. Because the past 6 years, the software has learned the dose response relationship to pretty much anything that you could throw at it. And the whole process of doing this treatment takes about 45 minutes. So I figured out early on the dose to heal, well, the dose response to heal simple things. And that's all I wanted to do, was to solve problems that everybody could relate to, like make my hair grow. And this is how I started. And I can just submit to you, if you do the right dose, 90 days later, it's going to make your hair grow. So there's no longer this need for multiple treatments to have therapeutic effectiveness, because if you do the right amount and the software knows the right hair dose of platelets to make, this happen, it will happen on the first treatment. But what changed everything for me in my company, was the application of platelets has only known to have been administered site specifically, meaning if I want to make the hair grow, inject it in the head. If I want to make my knee feel better, inject it in the knee. But in 2018, 8 months later, to make a long story short, I had a revelation. And it was basically, I called my wife and I said, I think I know how we're going to heal our son who was injured with a shot at 2 years old. And I said, even though my background is in stem cells, I said, I don't think that's the right thing we should give to him. I think we should give him a dose of really concentrated platelets, and I think we should do it to you and really jack up the dose, and we should give it back to you. And my wife, like all autistic moms who are the test pilots for anything they give to their child, she said, okay, well, what would my dad say? And her dad is a doctor. He's a medical doctor. And I said, well, knowing what he knows, that platelets are only responsible for clotting, I guarantee he'll say it will hurt you, but it won't. Now, my wife had I had a lot of street credibility with my wife, which is another story of why she would even go along with the idea of this. Let's really jack up the dose. Let's give it back to you intravenously and see what happens. Well, 6 years later, and close to 10,000 patients later, I can tell you that basically it unlocked and has been unlocking the body's ability of reversing these conditions that conventional medicine seems not fixable. I won't even use the word cure. But in some cases, I can say it's cured it because it's no longer there. And the blood results say that it's no longer there. And that's how we've become to be known as the Trudos IV therapy. And that's why many of you are on this call. So the question is how? How is it reversing? You're taking blood out from me. You're putting it back into me. I get the idea of dosing, but how is it doing it? And so I'm going to give you the 4 ways, and this will end this talk, on how this is doing this and reversing these conditions, whatever the condition is. The first is, the second you take blood out of your body, your bone marrow is immediately replenishing that population of platelets that are lost. So remember, I told you, your platelets are turning over about 70 million per minute. Well, in 30 minutes, you've already repopulated, sitting there in that chair waiting for this therapy. You've already replenished that baseline of platelets that you lost. So when the therapy is ready for you after centrifugation, you already have what you lost replenished, and then you're getting this super dose of of platelets based on your disease condition. So the body says, oh, wow, now that I have a lot of you, go out and go fix this, go fix that. Restart the repair system, restart the immune system. The second reason has to do with the fact that this goes all the way back to the Greeks, is that the difference between health and disease, or health and pain, is the body's ability to relegate proportions of things to one another, okay? And what I mean by that is, in our bloodstream, the hemodynamics within our bloodstream, we have our platelets, and we have our white blood cells and our red blood cells, if we just kept it simple. But what if I added everything else? Again, cell communication shut down, cells are being shut down. Well, guess who's the one thing that is altering ratios of everything to one another as it relates to health and disease? So at any given moment, your platelets are talking to the different cells and hormones in your bloodstream, altering these ratios to normalize equilibrium of the body. And so that would be, whoops. All right. So your platelets, when you infuse them back into you at a certain dose, you have this super high dose of platelets as it relates to everything else. And so guess what? Those ratios are going to start changing again. So you can measure your blood results 10 days later if you're really, really sick and your blood results are really, really bad. And I can tell you that they're going to change. But what do we do in conventional medicine? We can measure, say, something like right here. Let's pretend this is the thyroid right here. We can measure the thyroid and we can say, oh, the thyroid level is off. It's too high. I'm going to give you a medication to drop it down. Well, guess what? That's going to cause the platelets to start doing this again. And you did it with a medication. But if you let this therapy kind of figure itself out, let your body figure itself out, it will change these ratios back and start to equalize and normalize you out. The third way, which is probably the most important, is that when I take your platelets out of your body, imagine they're sitting here in this blood bag. Let's imagine 100 mils of your blood sitting right here. So your platelets are no longer being stimulated or receiving any information from any organ or any cell in the body anymore. They're sitting right here. So the second that I put it back into your body, it's like it's seeing the entire body for the first time again. And that technical term is called resetting your immune recognition and your repair recognition. So there's no longer this coexisting with the herpes virus anymore. There's no longer coexisting with the Epstein-Barr virus. Their days are done. It's over. It's saying your problem, you're getting out of here. Instead of this coexistence, which is what many of you have with a lot of viruses, it's this kind of game where, hey, if you don't do anything to me, I won't do anything to you. And that's an evolutionary thing that viruses have learned over time. And when you put this back into your body, your platelets are gonna determine, from a hierarchical standpoint, what is the most important organ I need to fix now. And so what we see is that brain, heart, and lungs, the nervous system's got to work. You got to have blood flow. You got to breathe. So in the 12 organ systems, those three will be addressed first. It looks like energy gets better. My cognition gets better. I can think. I'm breathing again. The fourth organ for somebody who has chronic fatigue syndrome might be the thyroid. For somebody else with chronic fatigue syndrome, the fourth organ might be the pancreas. Their insulin might get better. It's because their body chose to turn them off in a certain order versus somebody else. So the top three will probably be the brain, heart, and lungs. The fourth organ it fix is going to be dependent on you. And I bring that up because everybody walks in with knee pain. Everybody. You have Lyme disease, you have knee pain. You have chronic pain, you have knee pain. Well, in the order of importance that the body considers important out of the 12 organ systems, musculoskeletal is number 11. It doesn't care. Skin is the last. So if you have a skin condition, a rash, something you're dealing with at the skin level, then that means that it's already made its way through every other organ system, and it's now presenting itself at the skin level. So your platelets go back into your body armed with this resetting of the repair recognition, with the resetting of the immune recognition, and saying, I know what you need now. Let me go back to where you were. Let me give you what you need and finish that unresolved repair from, say, maybe 30 years ago. Maybe it was an emotional event that happened from a marriage. Who knows? But you're going to complete these repair events, and you'll start to, for those of you who can't sleep, you'll start to sleep, deep sleep. And so what happens is you'll start to exit out of these unresolved repair events, and you'll slowly work yourself back up the chain. And more importantly, that we see this with many people, this is what happens first, and we call it the shift. If you have emotional distress, if there is trauma in your background, you cannot get the physical healed until you deal with the sympathetic distress. So you give this treatment, and what happens is we call it the shift. People who don't cry immediately start crying. It's because the brain that tried to protect you from that event says, I can no longer hold on to this. I've got to detox it, and I got to get it out. And that's why, you know, whether it's autistic kids, they can start to connect. They will spontaneously say, I love you, Mom, without being prompted. Somebody who has Lyme disease, who can't face life anymore, they have this hope that's regained, and they can face life again, and they can connect with their family. So I'm going to skip over this one just for the sake of time, and stop the talk right there. But basically, the treatment is using your blood. Nothing's added to it. It's using the platelets within your blood at the right concentration for your disease, and relying on your body's intelligence to figure what's your problem and fixing it. The platelets are helping you restart and reset your body's immune system and repair system to exit out of those loops. And when that happens, symptoms start getting alleviated, and your condition starts being reversed back up the chain. So, Martin, I'll stop it right there and open it up and see if there's any questions.
Excellent. Thank you, Tapley. Can you hear me okay? Fantastic. So guys, listen, this is a fantastic presentation. I'm so glad that you're listening to it. As you can see, the platelets go way beyond clotting, way beyond. There's 2,400 growth factors in there to repair the body. If you're a patient of mine, we have been working to resolve systemic inflammation with one method or another. And you're also probably aware of Dr. Neil Nathan in the book Toxic, where he discusses the cell danger response. That comes from Dr. Robert Navio. When I first met Tapley, I knew this man knew what he was talking about, because he went immediately into the cell danger response and what it meant for chronic illness. When he's showing these loops here, what he's showing is that for many chronic conditions, you're not unable to resolve this chronic inflammation, these loops. And a lot of you are stuck in either step 1 or step 2 of the cell danger response and can't move around to step 3 or 4. Maybe I'll do a separate follow-up on this and just kind of plug Dr. Navio and show you those loops, but many of y'all are familiar with that. But this is the deep revelation that Tapley had, guys. And you know, everything else we've tried, you know, and they're helpful to some degree. As he said, you know, fixing the thyroid, giving peptides, hormones, you know, of course, stem cells, exosomes, all these things are helpful to some degree. But they're only solving one part of a huge system. And the body is made of systems upon systems of systems. And until the body has the right payload of growth factors to then coordinate this symphony of problems, we're going to be stuck. So we're excited to have this technology and to start implementing it in the practice. And I know that we have a few questions, and certainly can help you answer those, get those answered. And so I'll kind of maybe turn it over to some of the folks that might be on the call. You guys are super smart. Don't be afraid to ask questions. We're all learning, and we'll push it back to you. So
There's a question. There's already some in the chat room. You know what? Before I do that, I asked someone to come on this call. Her name's Elena. As a disclaimer, Elena was a patient. She had Lyme disease for 30 years, POTS, every virus that you could think of. She was, when I met her, she was, Elena, if you can hear me. But she, there she goes. Can you just maybe at a high level, I mean, I'll just ask some counterpoint, maybe, instead of going through your life story, how did it help your Lyme disease? And I know you had mold. How did it help those?
After suffering for Lyme for as long as I did, this actually gave me my life back. I am completely symptom free at the antibody level. A lot of my issues are resolved and gone. For things like POT syndrome, I've had one flare in the last year and a half. My systemic mast cell has remission.
How bad was your mast cell?
I took EpiPens everywhere I went, and every environment would send me into anaphylactic shock. I know, Martin, you might have questions for me too.
Well, I was going to say, guys, I had the pleasure of meeting Alina and Tapley at ILADS, the International Lyme Association conference. And I don't know, I was looking at, there's a lot of vendors at these shows and a lot of discussions. And first of all, imagine thousands of people in this conference, and we're all talking about Lyme disease and mold and all these problems and just this sort of high level, and then some stuff to do to fix it, like antibiotics. But internally, we all feel that, okay, wait a minute, that just can't be the answer, because we all know that there's plenty of people that have been on antibiotics and not getting better. So we wanted solutions, and I was looking for solutions. So I just looked at Alina. I didn't even talk to her. I just felt her over there. I said, wait a minute, I got to talk to this gal. And as soon as she opened her mouth, I'm like, oh my God, here's a person that's actually been healed of Lyme disease, plus mast cell, plus mold, without, probably did antibiotics at one point, but ultimately not that a medicine, using her own body's platelets. So think about that for a minute. In LDI world, we call that autologous LDI, or low dose immunotherapy. In other words, you take your own body's substance, whether that's blood, platelet, urine, you make a homeopathic dose of it, and then you reset the immune system. That's all it's doing. It's just that Tapley's perfected that using software. Anyway, Alina, this is why we're here talking and we're engaging you, because I was very touched by your story and just so moved to see someone so vibrant with so much energy and willing to help others to overcome this really horrific problem. And so kudos to you for fighting the good fight and sticking it out and overcoming this thing. It really is an inspiration to all of us, and it should be an inspiration to everyone on the call. And by the way, guys, everyone will get to meet Alina when you do the injections February 22nd and 23rd. She's a real inspiration. Just her energy alone will give you a good treatment. Okay.
Elena, before I get to these questions in the side chat, this wasn't the first thing you tried. I mean, you've tried many things.
No, yes. I did treatment after treatment. My only job was to get better, and nothing was working. And I had been in bed for about 5 years. Anything would send me into a flare, and it would be 6 months. And, I couldn't walk upstairs. I had given up. I'd written letters to my kids, and then I went and I tried this, and I had incredible results right away. I did suffer from some herxing after my second treatment. I do these every eight weeks still because I was so sick. What it's done for me cognitively, though, is probably the biggest component, and energy wise. I mean, I'm now back working full time. I travel about 4 days a week regularly, and I'm 53. So it's not like I'm 30 and doing any of this anymore. And I've been dyslexic for my entire life, and I'm no longer dyslexic. So the components of the brain is even more incredible than being, out of pain for the last year and a half. They wanted me on fentanyl patches and this, that, and the other thing. So, from that standpoint, there's, it's a process. Nothing happened directly overnight, but
the first treatment, how would you describe the first treatment and then the second treatment and then subsequent treatments? There's a question in there.
okay, my first treatment, my mast cell was completely put to rest. I have not had a mast cell flare since I started this. By week 3, I was 100% out of pain. My night vision came back, and mind you, nobody would drive with me. I actually wasn't to drive anymore at night. What else?
I mean, the second treatment, I mean, it did a lot of other things that are great to your body, but the second treatment.
Yeah, so my energy came back after my first treatment, and the second treatment, it zapped my energy, and I was tired for about 8 weeks. And I thought, oh no. My third treatment, can you hear me? My internet seems to be.
Yeah, you're good.
Okay. My third treatment, everything came back. And I've been good to go ever since. And there's ups and downs, of course, within the 8 to 12 weeks. But nothing, I've never had a low, like my good day being sick, if that makes sense.
Right. Absolutely. Wonderful.
Yeah.
So there's questions over here in the side. And you've you've measured your blood. Is there anything left in your blood?
So I had all the herpes viruses and Epstein-Barr, and at the antibody level, I have none of those viruses anymore. I have not taken a Lyme test yet, but that is on my list to retake it. But I haven't had a Lyme symptom in a year and a half.
Fantastic.
There's a question over here. It says, do I need to stop immune suppressant medicine beforehand? I mean, disclaimer, I'm not a doctor. That's between you and Martin. But if we're going to go, what's the word, offline, immune suppressant is just that. It's suppressing. It's if there's 2 ways of looking at this, I can take a medication that's going to be a defensive strategy, or I can go on the offense. And this is the offensive strategy. So if you take an immune suppressing medication, most of them are anti-inflammatory, steroidal. They're going to suppress the response. What we want to do is reset that response. So if you suppress it, then you're going to interfere with the treatment. So, things like, I don't know, IVIG, you kind of want to get off those and work with your provider to titrate off those if they need to be. You don't want to be taking these hand in hand. It's just going to counteract the effects of the treatment. Okay, I didn't see Martin respond. How do you know what to target first if you have multiple things? Well, if you walk in, here's the thing. You imagine a list of conditions that we can choose from that all have dosings. If you have, usually what you'll do is, let's pick the worst. Let's pick the worst because it's at this point when you have a lot of lights in the dashboard that are all contributing to one another, it's very difficult to see, okay, what is the problem we're dealing with right now? So when I say pick the worst condition, it's mostly going to be neurological. Let's pick something that's TBI related. Myasthenia gravis. Something that's neurological. If you have, I don't know, I have pain and I have this. My doctor thinks I might have Epstein-Barr. Let's pick the mold virus Epstein-Barr dose. So because after you do the treatment about the 8 to 12 week mark later, all these lights will be off the dashboard of the multiple ailments and allow someone like Martin to really zero in. Okay, now it's becoming a big glaring light that this is a problem. Before I couldn't really determine if it was, maybe it was, if it's one of many things, but once you do this, it'll wipe a lot of stuff off the dashboard so he can focus in on exactly what to do. And that just helps you get better faster. Whether it's a supplement, it's a ozone, it's a, any other type of modalities, which are going to be dependent on the condition that you're dealing with. There's a question about, do you target more than one thing in the analysis? Maybe you can do that. For example, okay, I did this last night at about 8:30. I'm in Connecticut right now. Somebody had inflammatory loss, hair loss, right? It was from COVID, and all they can see is their hair was lost. That's all they see. I said, listen, how about we do this? We can put it in the software that we can plan for a combined treatment. So let's get rid of the COVID because you obviously didn't have this, didn't have that, didn't have this, didn't have that before COVID hit. So let's give it to you intravenously and reset the entire system, causing the hair loss. And then, because you want to, let's go ahead and give you a treatment for the hair dose and we'll inject it in the scalp. So while the person was there, they kind of hit the problem from two different ends. And that's not for every condition, but that is an example where that could be possible. Whoops. My thing went. Is Trudos safe for someone who has buildup in their LAD and carotid arteries?
That's their left anterior descending, the Widowmaker. So, yeah, they're talking about calcium buildup and basically arteriosclerosis, so yeah, there's a thing called a glycocalyx, guys, on the inside of the blood vessel. It acts like a little sponge, unfortunately, and it can trap calcium and cholesterol. It's basically the latest theory on all this with coronary artery disease is damage to that lining. So what do platelets do? Right? Platelets going to repair the damage. There's a lot of things, supplements and other things out there to try to fix the glycocalyx, calm that inflammation down. But, ultimately, this is trying to heal a vascular injury, right? And guess what? The platelets got 2,400 growth factors to do that, to reduce the cytokine release there, reduce the inflammation, and bring in the growth factors needed to repair it. How would you respond to that, Tapley?
I would agree with everything you just said. And I imagine this person is asking this question because, there's a risk of, when you get to a certain age, you're at a risk of stroke for a number of reasons. I would argue, it's not even an argument. I would submit to you that this is to the degree that we would say platelets cause clotting. Oh my gosh. I would submit to you that this is the one treatment that actually reverses people that have, that are in the stroke demographic. So if you've had stroke, I've got hundreds of testimonial videos. It's that it reverses it, whether it's sensory loss or different types of nerve palsies. So there's very few things where actually there's really one thing that I can think of that wasn't a contraindication, but was more of a pause. And that was somebody who had a valve replacement with a xenograft, which is an animal graft. And that wasn't a contraindication. That's the only situation that I can recall where a doctor who was a cardiologist just gave pause and wanted more clearance from their other cardiology doctor. So there's really no contraindications. It's your own blood.
So, and I would probably add to that, Tapley, that with the heart in particular, you want collateral blood flow. Okay, so let's say you do have a plaque buildup in a certain artery. It's called collateral blood flow. And so what the platelet is going to do is help literally grow new blood vessels around any issue. So remember, it's making the blood vessels more elastic, which is increasing the diameter, which is increasing the oxygenation, which is increasing collateral blood flow. All that's a yes, yes, yes for preventing any kind of cardiac event, to creating a more youthful blood flow, increased stroke volume, pumping action of the heart. I suspect that PRP is actually doing just that. It's increasing literally cardiac output, because as it fixes the immune system, then it'll go in and start to fix the cardiovascular system. So yeah, stroke is basically the same thing as a brain attack, same thing as a heart attack. Okay, it's lack of blood flow. Your platelets are going to coordinate all that and increase blood flow, increase oxygenation. If you've got brain fog with mold and Lyme, it's going to do the same thing. It's going to increase blood flow to the brain and also help blood return out of the vessels of the brain to help your brain feel better. Yeah.
There's a question here that says, can you explain how it resolves emotional trauma in the brain? I love this question. And the second part is, does it rewire the brain, like neuroplasticity? So I love this question, and I'm gonna show you guys something. Shake your head when you can see this. Can you see this?
Yep.
So, wow, whoops. Sorry. I had it teed up and then it, but this goes, so when this is what I don't have any formal research in this. I've just been collecting thousands of pieces of data right in front of the patient. And here's what I've learned about people that have emotional trauma, that the architecture of the brain or your blood flow should resemble this, a healthy tree with thriving branches. But somebody who has had emotional trauma, who has mental illness, this is not my opinion, this is within the literature, that their brain architecture looks like that of a diseased tree. In so much as there's been injury that's caused there, but the tree's not dead. It's sprouting new limbs out of the diseased tree, and as it sprouts, it gets knurled like this. So the architecture of a schizophrenic brain, cerebral palsy, several mental health, autism, they look, so the brain's constantly trying to repair itself, but it can't. And so from a connection standpoint, to the person who asked this, a normal healthy brain should resemble direct connections, point A to point B. But when you have systemic inflammation, what happens is that connection that your body senses says, that's not good. Let me sever that. Let me create a workaround connection to point B. And that's our new connection. So this workaround connection is not as, it's not as strong as the original. And that's how in autism, that's how we get the spectrum. Okay, various parts of the brain are heightened, various parts are lowered. Now, how does that relate to emotional trauma? When you sustain an emotional trauma, and I've heard this 1,000 times. This can be the only thing that I could explain it at the time. And now there's evidence to support it. That when you experience, let's say, a rape, your brain will protect you neurologically from that because the impact is so severe. And that event is basically black box in your brain. And that connection is severed just for a little bit. While that event you experience alters your body top down, your organs, how they function. Think of stress, how you can't function. And so the body means to come back up and address that event. But the longer that the body cannot get back to it, the longer the body stays altered at the bottom level, that connection will start to do this, kind of like a diseased root. And eventually it's so far away that event is now black boxed in your brain, kind of like, and so it hasn't been able to be detoxed, if you will. So you can therapy it out. You can, you can do all the things you can do, but unless you establish that connection back, that event stays stuck there, and it will perpetually alter the physiological state of your health. I know this because we've treated thousands of people that have emotional trauma. And in the beginning, there was a string of girls. There was about 16 or 17 girls that, so for some reason, they all came from the same little area where I was from, and they all they were all teenagers, and they all had something happen to them, just fill in the blank. And they all had their hair dyed, they gained weight, lost weight, were on lithium. Basically, they were not even the same person. And so they get this treatment. And what I learned from the first one, which is consistent for pretty much everybody who has emotional trauma, is that your brain will reconnect to that event. It'll neurologically reconnect. So that, and it will access that event that happened. It didn't matter if it happened when you were 3 years old. In that night in your dreams, you will relive that event as if it was happening to you again. It won't be crazy. It'll happen like you're in first-person shooter mode in a video game. And it's just processing. There's no emotional component attached to it. It's just processing. And what people report is that they were able to get up the next morning and literally set it down like a bag of bricks. Now, that's obviously when you need to get therapy and have intervention, and maybe depending on the extent of the event, to get to a professional. But that event is been able to be detoxed, if you will. And so that's that shift. And the only way that people can describe what's happening to their body when that happens is they say, it feels like my brain is being rewired. And so to the person who asked that question, that's exactly what's happening, is because there's no other way to explain somebody who has no capacity to articulate what's happening to their brain as it's happening, other than to say it's rewiring. So Elena just gave you a great example. She's 53. She's no longer dyslexic. So the theory of neuroplasticity and the fact that we are hardwired after a certain age is not true. I can tell you whether it's somebody who has cerebral palsy in their 50s, it does not matter. Now, the incremental benefits they'll get from each treatment will be varied, but the fact that we can be reversed and we are neurologically pliable is totally, and we can rewire ourselves, is totally true. Can you comment on using Trudos with cancer patients? Is the concern of the growth factor of angiogenesis feeding, cancer cells? Obviously, the short answer is cancer is one of those where hundreds of cancer patients have been treated. Metastatic cancer patients, dormant cancer patients, bone marrow cancer patients, brain cancer patients, breast cancer, ovarian, pancreatic. And here's the thing I can tell you is that it helps the pain. It helps their pain. I can't tell you if it made their cancer go away because that was not part of our data collection. I simply did not want to know. Okay. The second part of this question, is there a role for patients with stage 4 renal failure? Now that I can say yes. Renal failure, kidney failure, people on the transplant list. For some of them, the first treatment, they were off the transplant list. For others, it took a second or third treatment and they were off the transplant list. But to my knowledge, everybody who's been end stage renal, kidney, liver, that they are no longer at end stage anymore. Their liver, kidney works. So that's for a child with severe autism. Where would you start? The brain, gut, emotional trauma. How many treatments will you need? So, let me just answer this broadly with many of you that have, if you have a systemic chronic condition and you're over in that category 3, you're going to need multiple treatments. And you're going to need this about every 8 to 12 weeks. That's about the time point, the 8 to 12 week mark, when the benefits will start to plateau. And that plateau will become your new equilibrium from which you will build from the second treatment. Now, I would discourage anybody from doing this treatment if your sole intent is to do one, whether it's because of lack of funds or for whatever the reason. I would not do one, because we learned early on that, like with anything, the body, it'll get you better. I would say it's rare, or it does not happen where a treatment does not get you better. It might not get better what you wanted to get better, because that's not the body's priority in your mind, but it will get you better. But the body can relapse. So how many treatments? It's hard for me to answer that question, because two people with, let's say, chronic fatigue syndrome have two different outcome expectations. One person just wants to get out of bed, and one person wants to beat it completely. Those are two different treatment frequencies. So I would say we tell people, do 4, base it, and then reevaluate from there. Elena is a case where, Elena, how many have you had?
I still do them every 8 weeks.
Why?
I don't know. Maybe I've had 12.
I know you said this before. Can you talk about, do you still take supplements and?
No. So when I start, can you hear me?
Yeah.
Okay. When I started, I was taking 50 supplements a day. My supplement bill was $1,500 a month. And I now take 3, and those aren't something that I actually take regularly. And then, the typical hormone replacement therapy, and that's it. So for me, this just makes more sense. And I won't go back to how I was, because I missed decades. So, I think you have that when your body finally recognizes hope for the first time, and you start to become better. I decided that I would figure out a way to roll this into a budget to make sure this is what I did to stay well. And fortunately, it's kept, I might as well be, back in my 30s with everything that's shifted.
So
it's that ratio, right? Of what is your baseline and where do you want to be?
So we've come to learn that patients with chronic diseases, insert the blank, whether it's autism or Lyme disease, you can budget for 4 and find 4, and then reevaluate it from there, because you'll be in a completely different space health-wise than you were And what we found is that people simply keep doing it because the cost of doing this, kind of like what she was saying, is less expensive than actually, it's like eating health. It's like eating organic. It costs a little bit more on the front end to find the alternative ingredient to eat the same stuff that you eat now. So you don't have to like eat rice and lettuce, but you eat less and you're healthier. So your grocery bill is not much and you're not in the doctor's office. So, so doing this becomes more of a preventative at some point. So the question about treatments, there's that. And when I start in the brain, the gut, the emotional trauma, if that's a provider thing, but here's what as far as where to start, but you have to have some basics in play, and you can't this is not a treatment that takes the place of everything that, say, someone like Martin's doing. You still have to have this interaction with, okay, these supplements you need to take now so they can get you better faster. But you can't be on one of these 6-month long inflammatory diet protocols because you'll get better, but you're going to be miserable. So it's kind of one of those things where, if you're that, then maybe this is something you do now to help your provider wipe a lot of things off the dashboard, and they'll be able to point you in the direction a lot clearer, faster.
Now, mind you, I follow a fairly rigid diet, and I do, things still to keep me well and.
But at a high level, I would say
I just choose to keep doing it.
Oh, sorry, you were breaking up. Sorry, Elena.
No, that's okay. Did you hear me? My internet seems to be
No,
slow.
not really.
No, I just said that, I do other things with this. This isn't just one and done. I see my doctors regularly, and then, everybody has an opinion when I'm in a clinic too, which is, I'm a little bit of a guinea pig. So, the ozone, I can't even remember, Martin, what everything you offer, but, you've got some great protocols and things that you put into place that, I think, everybody just pays attention to, and you put a treatment protocol together. You need a team, you need things, it's not just one and done.
Oh, so at a high level, I would say, inflammatory diet and IV nutrition are probably kind of like the basic tool belt of getting that under control, so you can limit or you can minimize a lot of the problems that this therapy has to deal with, kind of like the gut. But and maybe there's some supplements that your provider, but if you're on a plan that's 6 months long and you're miserable, I would say that's probably not ideal. But then after the treatment, that's when lymphatic massage or, Epsom salt or baths or, infrared sauna, that's when those things actually work better. That's when and it reveals itself depending on what your condition is.
Right, so guys, let me just chime in there. Tapley, a lot of our patients are breathing Brown's gas, okay, which is a very profound anti-inflammatory thing that they can do at home. Okay, it's basically activated hydrogen plasma form of that. So that's one great thing. A lot of you guys are doing detox programs and peptides and stuff and hormones and supplements. I think what Tapley's saying is your need for those things will go way down, okay? And it'll also reveal hidden layers, which we'll be able to jump on and pounce on and treat with a little bit more vigor. And so I think all this will work synergistically. There's no doubt about that.
There's a question about, I've been on prednisone for a long time. I've come down from a certain dose for 3 months to now 7 milligrams now. I can't seem to go lower and still breathe. If I don't take prednisone the day of the treatment, will my body reset quick enough to not need the prednisone later that day? It sounds like you're on a low dose. Again, that's a provider question. I don't want to get caught on somebody recording me and putting it out on YouTube.
Yeah, none of this is treatment advice, by the way, or medical advice.
You know,
Always work with your health practitioner.
and there's, I mean, I don't, that care is not what I do. But if you're on low dose something and you've done, then what this will do is probably tip the scales. It'll tip the scales. I wouldn't imagine that low dose would interfere. I still know people that get themselves down, weaning this towards the treatment, that they get them down to a low dose. But so that, to me, on the surface, is it looks like you'll still see the benefits of the therapy. But then the day after that, the third day, the fourth day, you've got to work with Martin really closely so he can kind of gauge and do testing, muscle testing, ART, to say, you know what, you can stop now. And that's got to be a real-time interaction. So I hope that makes sense.
Yeah, interestingly too, Tapley, you mentioned that one of the repositories for platelet is the lungs. And so we have cases of asthma and COPD. Okay, and what has been your experience with those conditions? The respiratory, the chronic inflammatory, reactive airway diseases.
I've got tons of videos. It goes back to the brain, heart, lungs. Is you got to breathe, you got a nervous system, you got to have blood flow, and it's like people who have allergies and who can't breathe. When they get the treatment, they can immediately. It's oftentimes they immediately say, "Oh my gosh, I feel like I'm breathing in peppermint." I can, and that's almost immediate. People whose oxygen saturation is crazy low, it'll start to climb. So I would say overall, the success has been very, very good with those types of people, simply because the order of importance that the body considers it's got to fix, lungs is it's right there at the top.
Right on. Guys, I think it's getting a little late. We may have time for maybe one more question, right? Looks like there's a question here about the lifespan of the platelets. If it's only 7 to 10 days, how can it keep repairing 8 to 12 weeks later? Tapley, what do you?
Right. The lifespan of the platelet, in normal conditions is going to say, all right, body's just fine. I'm going to respin up another population of this. But when you do this treatment, you're basically putting a therapy into your body that is responding to your current disease state. So you put this back in there, that's reset. And the platelets that you put in there are actively responding. But because they're responding and resetting that, they're actively engaged in the bone marrow to start spinning up platelets to exactly what you need, because that entire thing is reset. So the therapy can be seen as the first responders going through the wall and reassessing the entire crime scene and saying, reset the body to start activating this type of platelet production with these weapons, with these repair materials, until I give you further notice. So an individual platelet might die within that 7 to 10 days, but right behind him is another one just like him.
Fantastic. Well, guys, I think if there's no other real pressing questions, we probably need to let Tapley go and be with his family. I know Tapley got what, 5 kids? Yep. And so, wow. What are their ages real quick?
16, 15, 12, 11, 7.
You got your hands full, sir. All right. Well, brilliant work. Just amazing stuff. And we really appreciate you, inspired by you. I'm really inspired by all the patients on this call. I think you guys are really on the cutting edge of something really quite amazing. And thank you, Alina, for sharing your experience with us. And I think there's many, many more good things to come. I know you guys may still have a lot of other questions, so please shoot that to me or to the team here, and we'll get those answered for you. And of course, for all of you who are lined up to get the therapy in a couple weeks, we look forward to seeing you there. And I think that's it for tonight.
Good night.
Yeah. Thanks, Alina. We'll see you in
in
a few
week or
weeks.
so.
All right.
Okay.
You
Bye.
guys.
Yeah. Thank you, Tapley.
Bye, Martin.